welcome to gagrol.net. My name is Wally Sarkisian, and today we have a very interesting man. He's a doctor, a surgeon, and a successful businessman. You know, his story is 40 years, so I cannot describe all that today. But his name is Dr. Krikor Tatoyan. He's MD. He is board certified surgeon, a seasoned and well respected general surgeon. Dr. Tatoyan is the owner and medical director of both TatoyanMD, Medspa, and First Choice Surgical Center, Incorporated, with over 45-year experience. Just think about that. Dr. Tatoyan, welcome.
Thank you. Thank you.
You know, it's interesting of especially surgeon, like the practitioner doctors, they always, put little something on your heart, check things. But doctor, our body is like reserve of pool of blood. Every time, any place you cut, the blood comes out. How do you surgeons cut the body and know all those layer after layer from muscles, nerves, and with the blood? How you guys manage always fascinated me.
Yes, yes.
So first, tell us. We know like you were born in Damascus. You moved to Aleppo, then to Beirut, then you came to U.S. Tell us a little bit of U.S. story. How you got to be doctor.
Okay. So basically, what happened? My mother had a brother that went to Italy to become a doctor, and also her fiance went to Italy to become a doctor. Together, they were good friends. Then for 6 years, she didn't hear from them, so she thought they're dead. So she ended up marrying my father, and everybody told her, "Don't do it. Wait, wait, wait." But she says it's been 6 years. They're dead. And then so her fiance comes back. He's alive, and oh, it's the drama. But anyway, all her life, somehow she wanted me to be a doctor too. Constantly, she would encourage me, son, be a doctor, be a doctor. And I didn't want to disappoint her. So I figured I could make her happy. I wanted to be a good son. So, but I'm glad I listened to her. I never regretted it. I think medicine is amazing because it's got everything.
Yes.
It's got, it's got philosophy of life. It's got religion in it. It's got, you're helping people, and it's always exciting. There's always something new. It just, I love it. So what happened, I grew up in Aleppo until ninth grade. And because of my father's job and everything, he wanted to go to Lebanon. So the family moved to Lebanon. I finished high school in Lebanon. Then I came to the U.S. It's all interesting how I came and
No,
in
yeah, never mind that. Yeah.
yeah, we can't go into, it's too long. But I came to the US and went to college. I started in New York, and I was going to college at night. I started thinking, my God, I want to go to school during the day like all the kids do. At night, all these older people are coming to school. So finally, I went to the South. Why? Because I bought a book from a bookstore that has all about colleges. I was surprised. In Middle East, there's no special book that tells you about each university. I said, America is amazing. They have a college guide. It's got something written about each school, the strong points, the weak points. So I started reading it and everything. And then I found 20 schools that I could afford to go because I was saving money while I was working. Finally, I found a school in Tennessee, Johnson City, Tennessee. Anyway, everybody said, "Are you crazy? You're going to go to Tennessee? Who do you know there? You have no family in America. You don't know the South." But I said, "I'm going to go study day and night and be recognized. And I'm going to make it. I'm going. New York is not a place for me alone, no family in New York." So anyway, I went to the South. That was the best thing I did. I studied day and night, and they recognized. They said, "This guy really wants to study. This guy really wants." He keeps saying, "I want to be a doctor. I want to be a doctor." So they said, "Listen," they said, "don't worry about the money. If you want to study that much, you go ahead and then you can pay us later." So I was like, "Oh my God, my dreams are coming true. I can get my education." And when I was there, I met a friend, and he said, "You want to be a doctor? This is a 4-year college. Why don't you go? Why don't you apply and go to a university that already has medical school?" I said, "I don't know anything in this country." He said, "Well, my dad teaches in the law school. I told him about you." So anyway, I went there and they listened to me, what I want to do and everything. And so they accepted me. So I ended up going to Wake Forest University in Winston-Salem, North Carolina. So I finished college there. And so there they recognized me day and night, studying day and night. I used to have study groups. I used to tell the students, "Look, I can help you with math. I can help you with calculus. You help me with the English because my English was poor at that time. Let's study together. It'll be more fun, this and that." And the librarian would always come and look and see what we're doing. They'll see I'm on the board explaining things and everything. He went and told the professors, "This guy has a class. He has a class at night. He has kids listening to him and everything." And we were serious. I'd go, "Do you get it? Do you get it? You know, when you do this, that's why you come down to this," and so forth. And then because they recognized me and everything, so then I got accepted to medical school. So anyway, that's how I finished medical school in Winston-Salem, North Carolina. That was 4 years after college. And then I went 5 years to Baltimore to learn surgery. And of course, in medical school, the first year in medical school, we were learning anatomy. You learn the body. 4 kids, they give you one body, and you start from the back, you dissect, you learn all the layers, you learn the muscles, and so you learn all the different muscles and everything. And there came a moment they said, "Okay, we're going to have to cut the rabbit's gut, and then we have to sew it back together. Let's see whose rabbit lives the longest." So, and also one person will put the rabbit to sleep. One person will do this, one person. My turn came that I'm going to sew. When I was sewing, I suddenly realized, and out of the blue, I said, "Oh my God, is this what we do in humans? You mean we're going to be cutting things and sewing things?" I said, "I love it. I'm going to be a surgeon. That's it." Because when I was growing up, I was the one sewing up the soccer balls. I used to love soccer. And the balls that we had, they were from leather. I mean, and it would tear, and I'd sort of sew it up and fix it, and then it would tear again from another direction. I would sew it up. So, in other words, I love the idea of surgery, and that's made me decide that I'm going to choose surgery to be my specialty. Anyway, so then I went 5 years of residency, and I did that. And then what turned out to be an amazing thing. Well, one thing about medicine, when you finish, from day one, you have to buy malpractice insurance, just like a car. You can't drive a car if you don't have insurance.
That's
Well, how am
America.
I going to pay for malpractice insurance? I have no family, I have no parents in America, and my God, how am I going to open an office? How am I going to have secretaries? How am I going to, have all that? So in the meantime, I was looking in medical journals. I found there is a place, there are a lot of advertisements like that. One of them said, we really need a doctor really bad. I mean, we will guarantee your income. We will do this. We will do that. So I called them, and the administrator came all the way to Baltimore. He wined us and dined us, and I was impressed. I said, you know what? These people are going to take care of me. And he said it. He said, you're going to be like a king. Your car tire goes out, we'll fix it. You have any problems, you're going to be our town's doctor. I said, you know what? I'm going there. Urhats, hongats. In Armenian, there's
Yeah,
a
yeah.
saying, wherever there's bread, that's where you go. So I realized that's where my bread is going to be. So so we went there, and oh, it was great. I mean, the bank is giving you credit to get a house, everything was amazing. But what came with it was even better, all the experiences, because I was the only doctor for a 40-bed hospital. I mean, a heart attack comes, I'm the only doctor. So I am like, oh my God, I learned to be a surgeon, but during those 5 years, you learn a little bit of everything. Okay, okay, all right, morphine, oxygen, give some oxygen, give this, give that. I'm helping people left and right with multiple different issues. And then something else happens. The administrator, every few weeks, he sees me in the hallway. They used to call me Dr. T. They used to shorten everything instead of Tatoyan. They'd say Dr. T. So, Dr. T, when are you going to do deliveries? I told myself, is he kidding? He wants me to do deliveries, man. I said, wait a minute. I said, look, I mean, I've seen deliveries 1 month, but my specialty is like general surgery. I mean, I can do family practice also, but Dr. T, we don't have anybody. Please think about it. I said, well, I don't know. Then he would say it again. Then he would say it again. 9 months later, the nurse calls, says, Dr. T, there's a patient in the ER. This is her ninth baby. I go, yeah. Yeah. She goes, I can see the head. Do you want me to catch the baby? Do you want to come? My God, I told myself, what the hell? It's crazy. I said, I tell you what, I said, I'm coming. But I was full of like, what am I going to do? I mean, well, there's nobody else to do it. And the nurse acted like she could do it. So I went there. Next thing I see, one nurse on one side, one nurse on the other side, and the lady is holding this metal bars. It's an old like delivery table. And they're talking to her. Okay, breathe deep. Okay, do this. I got encouraged. And next thing you know, they start saying, push. And I start saying, come on, push. So the baby came. But of course, we've learned few things. There's this placenta. Armenians say, "Hanin bezdigin eshe,"
Oh,
they call it. That's the part that comes, you have to gently pull it out, because if you leave part of it in there after delivery, they keep bleeding. So you got to make sure you pull it all out gently. So I did that. Everything went fine. I gave the baby to the nurses. They knew what to do with it. So next thing you know, I start doing deliveries. For some reason, God helped me, I didn't have any problems. We keep doing deliveries. So I'm getting experiences. Next thing the lady says, Doc, would you tie my tubes? I've had too many babies. Next thing I'm tying people's tubes. Next thing you know, this. Next thing you know, that. And then I told myself, what if the baby doesn't come out? I need to learn how to do C-sections. I asked the next town doctor, I said, you're a general surgeon. Is this normal? I mean, we're doing deliveries. He says, this is the rule rather than the exception. He says, in small towns, the gynecologists, they don't go to small towns. What are we going to do when people need us? He says, I will show you. Next time I have one, I'll call you. You come and watch me and you learn it. One thing about general surgeons, we are specialized in the abdomen, meaning we know about all the rest of the organs. The one thing they didn't they didn't teach us too much, it was about the uterus, the women's, womb and the ovaries and the tube. They let other guys learn about that. So now that I learned how to open it, how to get the baby out, how to close it, well, surgical part is easy. I mean, once you see it, once it's just like a cook. Once you see Chinese cooking, I mean, if you're a good cook, you can learn the Chinese. Who says you can't learn to cook Chinese food if you know how to cook good Armenian food? I mean, you can learn it. So anyway, I started doing that. Next thing you know, I'm doing C-sections. So what I'm getting at, you may say, why you're saying all this? It started giving me broad experiences about the inside of the body, about diabetes, about hypertension, about tonsillectomy, about lung removal, about hysterectomy. It just became a broad knowledge. But at the beginning, it's scary. Kardinka, the sweat runs through your back. There are moments because you're doing things you have to do, but you really, you're new at it.
Yeah.
So anyway, it was amazing experiences. And then after doing that about 4 years, another town, I found out they have 13 doctors. Their surgeon had a stroke. So they called me. I found that I can go and work there. So I told myself, oh my God, it's better. They said, all you have to do is surgery. You don't have to look in people's ears. You don't have to do all of that. You can just do surgery day and night. I said, great. So I went there 8.5 years. And over there, they said, you got to be able to do C-section. Otherwise, it's not going to work because these family doctors do deliveries. If they get stuck, they need someone to do C-sections so that the whole thing works. I said, don't worry, I can do C-sections. Anyway, so I started doing C-sections there, also hysterectomies, also tubal ligations. The reason that's important, if I examine someone's abdomen, whether they're male, whether they're female, I know underneath what lives under the belly, what comes from what. A lot of people who don't know, they go, you know what? I think you need to see the gynecologist because they don't know what the hell is going on with the female organs. Anyway, so it was a good background experiences I had. Well, my facility right now, by the way, I work at the hospital and also I have my own facility. Uh, Half the month, each month, half of it, there are two hospitals, Sherman Oaks and Encino. These two hospitals, anything that goes there that needs a surgeon, for example, appendicitis or gallbladder problems, or you have obstruction, intestinal obstruction, or you have a colon cancer that is blocking you, or you have a rupture, something ruptures. All of these, they need to call a surgeon. I am a surgeon that covers these two hospitals half the month, like 15 days a month. Anything that comes in these two, if it's my name, call Tatoyan. This patient needs the appendix removed, or call Tatoyan for this, for that. So basically, I cover those two hospitals. But also, But when I say cover, I don't sleep there. I don't stay there. They call me only when they need me.
Yeah, yeah.
So if I have to run to do something right away, I will. Sometimes it could wait. Sometimes they come in with appendicitis. I tell them, give the patient these antibiotics, give these medications. I will see the patient 2, 3 hours later. So you know what I'm saying? It's like they call it the surgeon on call. So I cover two hospitals that way. Uh, and I also have my own practice in my office. I have an office where I can do also surgeries there, for example, hernia, hemorrhoid. I can do gallbladder removal. I can do tonsil removal. Many, many surgeries I can do in my own institution, in my own private institution. So I also do family practice now. It's been about a year. Lots of times patients used to say, Doctor, we want you to be our doctor. We want you to be our family doctor. I used to say, well, look, I'm a surgeon, this. Then I realized, why not? I mean, I could be their family doctor. I've done it for years as far as when I take care of patient, I take care of the whole patient. I'm
Yeah.
not the kind that, oh, that one go for this, that one for go for that. Because I love medicine. I always want to know what causes something. What causes something? I want to solve the main issue. Let me give you an example. You may have problems sleeping. You may have problem with anxiety. You may have problem with depression. You may have headaches. You may have insomnia. You may have erectile dysfunction. You may have sweating. You may be saying at night, I sweat. I sweat. I don't know why. No one knows why. Well, look, when your testosterone goes down, it could cause all of those symptoms. What they do, you have nervous, they give you anxiety medication, some Valium, Xanax, Ativan. Oh, you have headaches, they give you headache medication. Oh, you have tired, they go, I am tired too. A lot of doctors, they're funny. You tell them I'm tired, they go, well, what else is new? I'm tired too. Well, no, no, there is a reason for that. You can make people less tired. You can help them with that because they don't know the reason. They haven't gone into the hormonal aspect of life. And it's all these symptoms could get better. Or take women. You see, one thing that's been found recently that women need testosterone more than men.
Wow.
Always people used to think, oh, that's for men, that's for men. Now, Europe has been doing testosterone for women for 80 years. 80 years, Europe is taking care of that. So America learned from it. And 3 years ago, the whole world, endocrinologists in the whole world, the big ones came together. They said, yes, women need testosterone because women at the age of 20 used to make 5 times more testosterone than they made estrogen. But by 25, it goes down. By 30, it goes down. By 35, it goes down. By 40, it goes down. That's why women, 1 out of 7 gets heart attack before menopause. They die of heart attacks.
The
After
woman,
menopause, huh?
the testosterone is like a medicine because I don't know this thing.
Well,
It's a
yeah, yeah. What
medicine.
it is, that's a good question. What it is, our body, when we were young, our body had it. Our body had testosterone in it. But with age, it starts going down with age. It starts going down and we start having problems. And everybody says it's old age. Well, they are right. It's old age because now the new saying is old, old age is a deficiency disease. Think of what I'm saying. Aging is a deficiency disease. It's a disease. The reason you're getting old because you are starting to lose a lot of the things you had when you were young. Just like a land. The land starts not giving good fruit when everything is depleted. What do you do when it's for the land? You put fertilizers in so that the land gets rejuvenated. The same thing is true for aging, for a lot of the problems we have. But medicine doesn't recognize that because in medical school they did not teach us. You have to go to learn that in the last 20 years. You have to go to learn it separately from medical school. This is the anti-aging society. They get into the nitty-gritty of why we're getting old. What can we do to avoid some of these problems? So, in other words, now that I know that, I feel like it's a shame. These old people, they say, I'm not feeling good. And we tell them, all your labs are good. Doctor, my labs are good. Labs meaning the ones that we look at. You see, when you go to a doctor, he orders the labs that everybody else orders. Just like a restaurant, you go order certain foods, but there are other foods you don't order. You don't order everything that a restaurant offers. The same thing for a doctor. There are 3,000 tests. They don't order 3,000 tests. They order the main things. What are the main things? Your cholesterol, your fats, the triglycerides, HDL, LDL, calcium, potassium, sodium, your electrolytes. Then they order tests about your kidney. How's your kidney working? But they don't check your testosterone, your hormones, and everything. They figure we don't check that. We don't check that. But that's very important part of aging. And a lot of your symptoms are from deficiency of that. But what they do is this: you come and tell me you got anxiety, doc. I can't sleep. I got anxiety. If I don't know about that, I go, don't worry. I'll give you something that helps you sleep. Thank you, doc. Thank you, doc. So then you get a medicine that's going to help you to sleep. The medicine has its own problems. The medication has its own problem. You start losing your memory. And then you tell the doctor, my memory is going. Well, he says, that's with age. You're getting old. Admit it. Agree to it. You know. And then if you says, I'm getting fat, he says, go exercise. Doctor, I have no energy. How the hell I'm going to exercise? No, you don't have willpower. You don't have willpower. It's your problem. You are the problem. You don't have willpower. Doc, I have no energy. How the hell I can exercise? But you see, when you give them what they need, their energy comes back, then they can exercise. So what I'm saying is depression, anxiety, fatigue. Some people sleep, they get up, they're still tired. They're still tired. They need energy. Energy is the stuff of life. I tell you, I don't know about you, when you're tired, you just need energy to get up, have some enthusiasm, have something to work.
Correct.
So yeah, so the answers are found now. And also the thyroid is amazing. The story of thyroid is amazing. I also treat the thyroid gland, because the thyroid gland sits here in the neck. It orders all the cells in the body respond to the thyroid. If the thyroid works slow, everything else is slow. You gain weight. Again, you don't have energy.
But is
Your
this
bowels
test?
don't move.
Are
You
there
get
tests for
constipated.
those?
Huh?
Are there tests for those things?
Well, here is the story. There are tests to it that everybody orders. It's called TSH, thyroid stimulating hormone, which is made in the brain. They look at that. If that's normal, they tell you your thyroid is fine. We go, okay, doc, okay, I'm glad it's fine, but why am I so tired? Why am I constipated? Why am I, no matter how much I exercise, I don't lose weight? Well, I mean, what can I do? Your thyroid is normal. But here is what they're missing. The thyroid gland makes T4. T4 The reason they call it T4, it's got 4 iodines on it. T4 doesn't do anything. It has to be converted to T3. T3 is the main one that makes you lose fat. T3 is the main one that works on the cells. They don't check it. They do not check the free T3. You can ask all the people that are listening, what did your doctor check? Oh, they checked TSH. They said it's normal. But under stress, with aging, when you get older, when you go through stress, your son dies or somebody dies, or you yourself go through big surgery, or anything that's stressful, obesity, say you're obese, or diabetic, when you're diabetic, it doesn't go from T4 to T3. If it doesn't go to T3, you will be tired. You will have all kinds of symptoms. Your heart can only use T3. You got to have enough T3 because that's the one that goes into your heart. So what I'm getting at, they're not looking at T3. They are looking at TSH and they're saying you are fine when you are not fine. They have to look at T3.
Yeah,
And
but
okay,
yeah, but when you say look for T3, is there medicine for T3, for example?
of course,
Okay,
of course, there is medicine you can just give T3 because if it's not going from T4 to T3, you can give medicine for T3.
okay.
Oh yes. So there's so many ways to control that, and so many ways to also prove that that's what's happening. There is a test. I mean, you're not a doctor, but there's a test called reverse T3. When your body says, "I'm not gonna help you to go to T3 because you are sick, you are obese, you have diabetes, you are under stress. I'm not going to do that." Then it makes reverse T3. They never check reverse T3. Very few doctors will know about this. They will check it. When your reverse T3 is high, it doesn't even let your regular T3 work. Now there is something else you can do to help these people. Thyroid is so important. It controls the whole body. You need energy. You need to correct that. So
So people come to you with those symptoms, like and
of course, they don't they come to me with fatigue. They're just tired. You ask them their questions, they go, "Do you sleep okay?" "Oh, doc, I sleep 2, 3 hours. I wake up. I can't go back to sleep." They all have these. The problem is if you don't ask, sometimes they don't tell you. The reason they don't tell you, they think there's no answer for that. They think that because all this time no one has been able to help them with that. So sleep, they may talk about it because they know you may give them something for sleep, but they're not going to tell you all these other.
but you know, like sometimes like there is no vitamin doctor. For example, you go take calcium, and then you find out the calcium is good for your bone. It end up bad for your heart. How people figure this things out?
Wait. Oh my God. You asked a smart question. Oh my God. Oh my God. This is very smart. Listen, first of all, vitamin D is the one that helps you absorb the calcium from your gut. Whether you drink milk, whether you take calcium, whether you have cheese, whether vitamin D is the one that makes you absorb it. But there is a trick. You have to take vitamin K2 with the vitamin D. Here is why. If you have too much calcium in your blood, calcium says, "Where do you want me to go?" Body says, "Well, I don't know." Okay, it can go inside the vessels. It can fill your vessels with calcium, and your vessels will be hard like a rock. But if you take vitamin K2 with with your calcium and vitamin D, you need with vitamin D, It will tell the calcium, come here, go into the bone. Don't go inside the blood vessels. Get inside the bone. We need calcium inside the bone to strengthen the bone. We don't need the calcium to be swimming around and going inside the blood vessels. So the one thing they don't tell people is that make sure you're taking K2 with the vitamin D so it will take the calcium and put it inside the bone, not inside the vessel.
Okay, but about maybe 2 weeks ago, I ordered K2. But when you read about it, it says K2 create clot in the blood, in your vessels. So how do you manage?
No. K2, it never does that. There are 4,800 patients. They tried the K2 on for 10 years. K2, in a certain numbers, in a certain amount, you have to give it. It will avoid you to have heart problem. 46% will help you not to get it. Now, K1 is different. It stops the say you're taking Coumadin. Coumadin helps you to thin the blood. But if you take vitamin K when you are on Coumadin, it reverses the effect of Coumadin. But these people, you're giving Coumadin to thin their blood, but vitamin K works against Coumadin.
No,
Not that it itself is causing problem, it works against Coumadin. So K2 also has many other benefits. So basically, you need a doctor to separate things and make sure what you have, make sure that Coumadin is an old idea anymore. You always have to have blood tests to see your level. There are smarter medications for blood thinning. Okay, Coumadin is a little bit old now.
sorry to throw all these things on you. Uh, uh, like aspirin too. They say aspirin it's you have to take every day. It's good for your heart, but then aspirin is bad for your stomach and for your liver.
Well, very, yes,
Explain
very
that.
smart, very good. Now, aspirin can make you have ulcers and things like that. Years ago, they said it's good, let everybody take it. They found out the benefits are not as good as the dangers it can causing. So now you don't recommend it for everybody. You recommend it only if you're backed into the corner. But now we are finding fish oil will thin your blood and it will avoid 90% chance of heart attacks. If you take at least 3 grams of good fish oil has got to have DHA and EPA together in it. Vasepa is not good. Vasepa has only EPA in it, and they keep giving it because it's cheaper. They give it to the patients. Lovasa is a better one because Lovasa has EPA, DHA. Our brain is made of DHA. Most of our brain is made DHA. You want to keep your memory, you want to do that, you got to take some fish oil that has also DHA in it. Lovasa has DHA and EPA together.
Is Lova's a product name or what?
Lovasa is the
Okay.
brand name of a fish oil that the Medicare government will pay for it, but they give you the generic. It's okay. The generic is okay, but at least it has EPA and DHA.
Amazing what 45-year experience does,
Well,
huh?
yes, you just see, that's what I'm saying. If you love medicine, you keep reading, you keep learning, you keep questions keep coming up.
So aspirin now it's
Aspirin now is just, certain people that have stents and this and that, they are scared because of the stent. They are scared that it may get plugged up. And, it's only the baby aspirin, but you have to be careful. It could cause problems too. What can you do? And now there's stuff for those blood vessels. You see, testosterone also opens up your blood vessels.
Wow.
Oh yeah, it starts opening it up, the blood vessels. So see, that's why you don't have that problem when you're 20-year-old, because you've got so much testosterone. And why does it happen when you age? Because you lose all the testosterone from your body. Same thing with women. The minute they get into menopause, 6 months later, their cholesterol starts coming up. And then their blood pressure starts coming up after menopause, because they also lose estrogen, not only testosterone, then estrogen. So the idea is we want to give people what they had when they were 20 years old.
I had a
We
couple of
want to
people.
give people what
Uh,
they had at age 20. There's nothing written anywhere that you cannot have what you used to have at age 20. It's
when
not written anywhere.
when I put on Facebook like I'm gonna interview you, there I had a couple of email sent me. Some of them are, I don't wanna ask you, but some of them, I think one was lady from Yerevan, and she said she's always sweating, and then she always got tired. Can you ask doctor? I said, well, those things you need to go see him. You can't just ask. But
They
if you,
wouldn't know how to answer. No, you can go to the doctor, say sweating, this and that. They wouldn't know how to answer that. If the sweating is below the knee, that's testosterone. If the sweating is above the neck, if the sweating is above the neck, that's from estrogen and all that. But I address both of the problems, and all the sweating will go away 100% of the time. I guarantee it. Can you
wow.
guarantee anything in medicine? I can guarantee that.
So the, so
Yes.
there is the one below neck and above.
Below the neck, if you feel hot, you sweat, and you have to change. A lot of them sweat so much they change their shirt at night 2, 3 times, the undershirt, because they sweating so much. This is not a laughing matter for those people. They just don't know why. Some people, they work a little bit and they start sweating. They tell me, I don't sweat, but the minute I start working a little bit, oh my God, I just sweat. Well, the body is crying. The body is crying. Body says, give me what I had when I was 20 years old.
Okay, so I know you heart is not your expertise, but your 40 year probably teach you so much things. I'm just gonna put this picture here. I'm gonna
O-
just 1 second here. I'm gonna move it on my side.
Okay, I got it.
You see it. So basically, where is it? Like there is
You,
two vessels, red. It goes into heart. Is those vessels blood goes from here to heart, or heart pump it out? So I was very curious.
oh, now very good question. This is very important thing for people to understand. Look, uh, let me see your face. Put the picture the other way or
Okay.
whatever. Uh, Now look, uh, the heart is made of muscle. Let me explain to you. Take the picture away so I see your face. Can you put the picture to the other
I'll
side?
just put it here in between us. 1 second.
Or maybe anyway. Oh, good, good. Look at my hand, right?
Uh-huh.
You see my hand?
I see it.
You see this, each finger has a blood vessels feeding the finger. The same way the heart is a muscle. The heart is a muscle. The muscle itself has pipes feeding blood to the muscle. The heart, the other blood that the heart is pushing away, it comes in the chamber. It comes inside the heart. The heart pushes it away to go to the brain, to go to the kidneys and everything. But the heart itself is a muscle. If the blood vessels coming to my finger gets blocked, the finger will turn dark and it will die. I know what you're saying. What is this blood? It pushes blood, it pushes this. So the muscle, which is the heart made of muscle, the muscle itself has tiny blood channels that feed think of it, my fingers. It has to feed the finger. This finger, if it doesn't get blood, the finger will turn black and it will die. Just like this part of my hand needs blood, this part of the hand needs blood to live. The other blood that the heart is pushing out comes inside the chamber. The dirty blood comes back.
Is that
The right side of the heart pushes it to the lung.
is
The
that what
lung
they call them
cleans it.
blue? Is that what they call them blue?
Exactly. The blue is the used up blood. Used meaning it went to the legs, it went to the head, it went to the arms. All the muscles said, "Give me your oxygen, give me your oxygen." They took the oxygen away. That's why it turns from red to blue,
Wow.
because the oxygen is low. Then that one goes to the right side of the heart. The right side pushes it into the lungs. And when you breathe, they get the oxygen, then they go to the left side of the heart. The left side says, "Okay, I'm going to now push you back to the heart." So the left side takes it and boom, it pushes it to the rest of the body. The rest of the body says, "Thank you. Now we can use the oxygen." They use the oxygen, then it goes back to the right side of the heart. So this thing keeps going on and on and on. But what we're talking about, when you get a heart attack, the blood vessel going to the muscle of the heart, muscle, it's made of muscle. If you don't, if those little tiny blood vessels that you saw in the picture, the ones that are on the heart, those here, the ones that, look, it says right coronary, that is supplying blood to the muscle of the heart. I mean, do you get what I'm saying?
Yes, yes.
It's a muscle. The muscle itself needs blood. We're not talking about the dirty blood that is coming from inside. It comes inside the chamber. The heart has chambers in it.
Correct.
So the dirty heart goes inside to the chambers. So
Okay.
therefore, testosterone, it opens up. It makes these tiny right coronary, right acute, left coronary. It makes those little wider, so more blood goes to those muscles. It also takes care of the plaque inside. It also reduces the plaque. It also tells the muscle work better. It pushes and makes it work better.
So this here.
This is, you see, this is a picture of a heart, what do you call it? A vessel that has gotten narrow and everything.
So what is
Uh,
the yellow? What is the yellow part?
the yellow is the LDL, the bad cholesterol. The bad cholesterol, it starts going there, it starts pushing and making the blood vessels squeeze. It squeezes it and it's finally closes it. You see, because you see, it's broken. There is a place it starts breaking, and there is a test that we can find out if you're about to break that vessel. There's a test called MMP9, MMP-9. You get that test, it tells you, shit, you better be very careful. You're about to have a place
So
like
there
it's.
is so there is test for this one that in
There's
advance.
a test that the white blood cells in that area produce when they notice that is cracking. That place is cracking, it's about to break. And then there are things you can do to hopefully avoid it. But you see, now there are certain there is one medication now in the world that's been patented to help inside the vessel.
Wow.
One medicine in the world that's patented that's going to help the inside to make it smooth and to put a covering on it, to put a covering over that place that's about to break so that things go smoothly through that.
You should charge $1,000 an hour.
Well, yeah, but what I do it for my Medicare patients for what Medicare pays. So, but with this knowledge is really has no value because it's just for years
I
of
know.
learning.
I know. I could tell. I could tell you that your 40-year experience, you can buy it. You know, you can made it for in overnight. You know, so
Yes,
you put
yes.
yeah. Now this uh, when they when this calcium is built from inside or from outside.
No, the calcium builds from inside. It's a pipe. Inside the pipe, calcium gets laid down. It gets laid down on the
But it look
inside.
where then those yellow ones that you see pushing, is that yellow one or the calcium or
No, yellow one is the fat.
oh,
There's bad fat and there's good fat. Medicine so far has one thing they try to fight. They try to fight and lower your cholesterol, hoping to lower your LDL, low density lipoprotein, LDL, because if you have a lot of that, that's bad news for you. That's the one that enters these damaged areas. It enters in it. It starts plugging up the vessels, LDL. So they give you Rapeta, and things like that. But one thing about uh, cholesterol medications, if a woman takes it 10 years, she starts developing breast cancer. And they are finding that it's not helping. After 10 years, they did research. It's not reducing the death rate. It's not reducing anything, but it shows that your cholesterol is low. But the reason it's not reducing, the cholesterol itself is a building block for hormones.
so you're
In other
telling
words,
so you're telling me
everybody thinks the cholesterol is the enemy. Cholesterol enemy. Cholesterol is the enemy. But if you don't have cholesterol, you cannot make hormones. Take a man, if his cholesterol is less than 160, he can't make testosterone. These men who are too low, their face is pale. They are they're just hardly
like me,
living.
huh? Like
And
me.
but they say, well, my cholesterol is low, doc. My cholesterol is good. But if you don't have cholesterol, you can't now build something else. Everything is meant for a reason. Cholesterol, God didn't put cholesterol there to be your enemy, to hurt you. You need some of it. So it has to be careful. Don't lower it too low. Women, don't lower it below 150. When men, don't lower it below 160. So all of this is important. It's not like, hey, I got your cholesterol low. Okay, you got my cholesterol low. You screwed up my all hormonal world. And when you screw up my hormonal world, you did other damages. You did inflammation in my body. You increased other bad things in my body.
So
And more
so
anxiety, and now you can't sleep. If you don't have progesterone, you can't sleep. These people, women, the elderly, all of them, doc, I can't sleep, doc. I sleep 2 hours, I wake up, I sleep 2 hours, all day long, I'm sleeping all day long. They're messed up. People are messed up. They need to be fixed. So
so the you know the what is the medicine they give for cholesterol? Stan. Uh, some people
I
say,
think the best way to do,
but
when you put testosterone under your body in 9 months, your cholesterol, your triglyceride will be straightened out.
now they
This
say
is the
that
promise
medicine.
of the European study. You give people back what they had at age 20. In 9 months, they have no more problem with their testosterone, with their triglycerides, LDL, HDL. They can throw those drugs away. It takes 9 months.
But they say the people who are on those statin, I guess they call them, they're like Lipitor stuff like that.
Statins, yeah.
Right? Is they say once you are on, you can't get out of it. Is that true?
No, who says it's you're free? No, you can stop tomorrow. No, 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 no. Yeah, no. No, you can stop it because it's causing danger in women more. It's proven, proven. If they keep on it 10 years, they're going to have more cancers of the breast. And it's well known the types of cancers they develop once they have that in there because they lower progesterone. When you lower the progesterone in the body, that's a protective thing for the breast. it protects the breast from cancer. So you lower it, and that will cause more cancers in the breast. So, and they found out after 10 years of study, it did not even save one life. It did not save one life. But it did lower cholesterol, but it's not saving life. It's causing more cancer. It's causing more stuff. Yeah.
Yeah, but it's just amazing in technology and medical. Like there's a lots of good things, like both.
Well, yeah, but the thing is, medicine will tell you, what can we do? What can we do? We have to LDL, the bad cholesterol is getting in those things and causing blockage. The only thing we have to lower LDL. LDL is the low density lipoprotein. That's the bad cholesterol. That's the only thing we have. But you tell them, did you change anything in the last 10 years? The mortality, did you save mortality? Did you prove to us that in the last 10 years the mortality rate went down in these people? That's where the pudding is. If you say no, people are having death, people are having death from heart the same rate that they were having before they took statins. So that tells you, what are we doing? We got
So
to go back to basics. Did they get heart attack at age 20, women? They didn't. Did they get heart attack at age 25? They didn't. When did they start having heart attack? Before menopause. Why before? In the meantime, their testosterone went down. It's well proven now from the European studies, 80 years, that the reason women get heart attack before menopause is they get low on testosterone. So the thing to do, get back on what you used to have at age 20, what you had at age 20. And now the testosterone is being used is not synthetic. It's not synthetic. It is pure. They're making it pure in association with Mayo Clinic. It's a pure testosterone. It's not like some kind of synthetic. It's just like your body's testosterone.
do
So
they like it's like a medicine? People take it.
it's a medicine. We call it medicine, but it's something that you used to have. We're going to give it back to you. You used to have that.
Okay,
So in a way, it is medicine. But
got it.
it's not like something that you didn't have. You see, listen, no one has deficiency of Lipitor. Your body doesn't say, I am lacking Lipitor. No, but your body can say, I am lacking testosterone. I used to have testosterone. But your body cannot say, I used to have statins. I don't have statins. Give me statins. No, you did not have statins. We're giving it to you artificially to lower something, and it's causing danger in something else. But what we're giving you, your body can say, I used to have a lot of that. I don't have it now. So give me what I used to have. So this is the difference. Your body doesn't say, I used to have statins, give me my statins. The reason I'm talking like this, so people really understand there was no deficiency of status in your body, but there is a deficiency of testosterone in your body.
It's been like it's gone like we've been like in few seconds. It's just 1 hour. It's such an interesting subject. We need to
Well,
be.
it's so interesting. It's
I know,
revolutionary.
I know. Okay, so now we're 1 hour on this. So definitely, positively, we need to bring you back more and more and more for more segment because this is so much in it. So I want in this one, I want to give you the last word. You say whatever you want, and then we'll close it. We're definitely, you have to come back next week or week after that. We continue.
All right, all right. Well, I mean, in closing, basically, I wasn't really prepared I didn't even have notes about what to do. In closing, I guess I'm excited about medicine lately. When I found this out clearly, I started the testosterone 10 years ago for males. And my wife, I gave her some testosterone as a cream, but I did not know what level is the best level. But they told us it will make you feel good. And I used to give myself testosterone shots. I would feel good for 4 or 5 days. Then, the effect goes away. So every week I used to give a shot. And if one week I told myself, I don't want to use the shot, then I would feel tired. I go, oh my God, I'm so tired. Then I'll give myself the shot. But with this, when I joined this group and learned about the European experience of 80 years, and I realized, wait a minute, you don't have to do the shots every week. You can do the pellets. They call it pellets under the skin. That it will last 5.5 months. You don't have to give yourself shot every week. In 5.5 months, you have it in you, and it keeps the level straight. And also, they told us about the German study. Germans studied thousands of men. They found out if your level is less than 650, they said these people die sooner than if their testosterone is higher than 650. They said these people that are below 650, they will get diabetes, they will get heart disease, they're going to have erectile dysfunction because all the vessels start closing, they're going to feel tired. These people are doomed to have all these problems. They need to have it above 650. But if they want to keep their bones, if they want to keep their brain, and if they don't want to get a bad prostate cancer, they have to raise their testosterone above 1,000. So from this group, you say, when you tell me what's the end of this talk, from this group, I learned the best way of doing it, and I learned the levels. What is the level for a woman to be? What is the level for a man to be? And when I learned all this and all the benefits and everything, I am lately excited. It's just I feel like I have a message. I feel like I can help people because medicine, believe me, is depressing. You know why it's depressing? You go to a doctor. What has he got to give? It's more like this. Hey, Wally, what can I do for you? You can say, doctor, I'm here. So you tell me what you're gonna do. But a lot of times they go, well, I mean, what I mean is, do you need something? Do you want me to renew your medicine? What do you need? Well, yeah, but lately I'm getting headache. Oh, really? Well, let me see, and I'll give you some good medicine for your headache. But what else there is? Well, my sugar, what do you think? Let's do some lab work. Oh, your sugar is up. I'll give you something to lower it. By the way, testosterone can cure your diabetes in a lot of people if it's not a late diabetes. If it's early diabetes, testosterone can cure it, can make you get rid of your diabetes if it's not a 20-year-old bad diet, So what I'm saying is because it makes more insulin and it makes the tissues more responsive to the insulin. The insulin will work better when you have that. And also the fractures. After age 50, 50% of people will break bones. And if those people end up in bed, 1/3 of them die in that first year. Because when you're in bed, no one moves you, no one turns you every 2 hours. You can have blood clots and you can die. So we're talking about fractures that we're going to avoid and we're going to build your bone from osteoporosis.
Okay.
8% every year. In 3 years, you build the bone 25%. You avoid fractures. Also, the brain memory. It's going to help your memory because amyloid deposition in the brain, testosterone avoids amyloid deposition in the brain. Testosterone increases blood supply to the brain. Testosterone doesn't let your cells die. It's called apoptosis. It's against apoptosis, cell death. You know how sometimes people used to say this man's good bagase. Good bagase, meaning something is empty. Well, they're true. The cells keep dying, but this one is not going to let your cells die. Testosterone has all those great benefits. Anyway, so I'm excited. Basically, I'm excited that I have something to offer, not just give you medicine for disease. I want to give you medicine for health. There is a difference between medicine for health and medicine for disease. All what we're doing is giving you medicine for disease. I'll give you something because you have gout, uric acid elevation. I'll give you some medicine for this. But why can't we make you better, and healthy? So that's the excitement.
Well, you are a medical library. You have so much in it, and I thank you very much for that. And for our viewer, thank you very much for watching, and definitely want to bring Dr. Tatoyan back again because there is so many other area and we could talk about it. And thank you. We wish you all the best.